Okay guys, today I'm going to show you a detailed assessment of the front rack mobility. So if you have an athlete that's struggling to get into the front rack position, this one assessment here is going to give you all the answers that you need. So when it comes to the front rack position, the limiting factors could be shoulder external rotation, could be shoulder adduction, it could be pronation, it could be wrist extension, could be elbow flexion. So all these are areas where there's potential for a mobility restriction to limit the athlete's ability to get into the front rack position. This one assessment is powerful because it can give you the answer. So you'll have your athlete start in the supine hook lying position. From here, you'll have them externally rotate the shoulder, just like this. They should be able to get their wrist to the ground. So if they try to externally rotate and they can't get the wrist to the ground, then put a check mark there. They have a shoulder external rotation limitation that's going to affect their front rack position. If they can get fully externally rotated, next thing you'll have them do is hold that position, roll up into the side lying position. Now we're testing shoulder adduction. If they couldn't do that, if they try to get over but they can't get all the way over into a straight vertical side lying position, well, now we know the limitation is shoulder adduction. Now if they can do that, then we move on. So they have external rotation, they have shoulder adduction. The next thing we're going to test is, can they pronate the wrist? So can they pronate? If from this position they can't get their hand turned all the way out into that pronated position, well, now we know the limiting factor is pronation. If they can pronate, then we move on to wrist extension. So from this position, can they pull the wrist into an 80 to 90 degree position, preferably 90 degrees, closer to 90. If they can't pull the wrist into 90 degrees from here, then the limiting factor is wrist extension. If they can get to 90 degrees, now we're going to test the last piece, which is elbow flexion. So if they passed everything, they got the wrist extended, but now they can't flex their elbow to the front rack position, then the limiting factor is elbow flexion. Now it's perfectly reasonable to expect that maybe on someone that's limited, they have multiple limitations or restrictions affecting that movement. So that's certainly a possibility. They may just have one limiting factor. But work through that front rack mobility assessment anytime you have an athlete that's struggling with the front rack position. The last option is if they seem to pass all those tests and they can get in a good position with the one hand, but they still can't do it bilateral when they're standing, then now we want to test that bilaterally. And kind of picture I have a blanket around my back and I go to put it around my back and pull tight. Sometimes that posterior fascia between the shoulder blades on the top of the back limits. There's just too much soft tissue tension for the elbows and the shoulders to adduct together and get into the front rack position. So that's another possibility. This is a great assessment to keep on hand at your front rack mobility assessment.